welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here is what we have for you all from the world of medicine. A rare connection between the retinal layer thickness and cognitive decline as in cases of Alzheimer's disease. Retinal layer thickness is hypothesized to be relative to cognitive function in patients with mild cognitive impairment and Alzheimer's disease together. However, longitudinal cohort studies of the healthy older population is very limited. A new cohort study found that baseline macular retinal nerve fiber layer thickness is associated with baseline cognitive function scores and follow-up cognitive decline. These findings suggest that the macular retinal nerve fiber layers thickness could be considered a predictive biomarker for evaluating the cognitive function in older individuals. The study that I am talking about is published in JAMA Ophthalmology, wherein a total of 430 randomly sampled individuals 60 years or older participated in the baseline assessment, 215 of whom completed the 5 years of follow-up. Using spectral domain optical coherence tomography, the study team assessed the thickness of 6 retinal layers in the macular region, that is the peripapillary retinal nerve fiber layers and the subfoveal choroid at baseline. The study included 430 participants, as I previously mentioned, and a thinner baseline total macular retinal nerve fiber layer thickness was associated with a larger decline in the scores during the follow-up period. Furthermore, the participants with baseline total macular retinal nerve fiber layers thickness below the lowest quartile cutoff value presented a greater decline in cognitive scores and a higher prevalence of cognitive impairment and Alzheimer's disease than those with retinal nerve fiber layer thickness above the lowest quartile cutoff value. Hence, it was highlighted that the macular retinal nerve fiber layer thickness could be used as a prognostic biomarker of long-term cognitive decline in adults who are 60 years or older. The link between COVID pandemic and maternal stress caused on the fetal brain development. According to a study published in Communications Medicine, self-reported maternal psychological distress during the COVID-19 may be associated with changes in the brain of the developing fetuses. Have you ever thought about it or rather analyzed this kind of a situation? The study assessed the potential impact on the pandemic itself on pregnant women and their developing fetuses before birth rather than the impact of COVID-19. The study involved 65 women who were pregnant during the pandemic and 137 who were pregnant prior to the pandemic. None of the participants assessed during the course of the pandemic were known to have any infection with the SARS-CoV-2 virus. And from the 202 participants, 173 mothers were questioned to investigate any distress experienced during their pregnancy period, that is either including anxiety, stress and even depression. The authors found stress and depression were reportedly proportionally more in mothers who were pregnant during the pandemic. In overall, 27.6% women in the pre-pandemic cohort and 52% in the pandemic period were considered to have higher psychological distress. The authors observed that 3 brain structure and volumetric measures were decreased in the fetuses from the pandemic cohort compared to the pre-pandemic era. They further suggested that this variability and inconsistency could indicate multiple factors that may be involved in the fetal brain development. About the easier ways to swallow tablets in various forms that are essential and only available as pills. To make it easier to give those medicines, researchers have created a drug-delivering gel that is much easier to swallow and could be used to even administer a variety of different kinds of drugs. The study that I am talking about is published in the Science Advances journal, and these gels made from plant-based oils such as sesame oil can be prepared with a variety of textures, from a thickened beverage to a yogurt-like consistency. The gels are stable without refrigeration, which could make them easier to get to children. They could also help adults who have difficulty in swallowing pills, such as older people or people who have recently suffered a stroke. The researchers explored several types of plant-derived oils, including sesame oil, cottonseed oil and flaxseed oil. They combined all these oils with edible gelling agents such as beeswax and rice bran wax, and they found that they could achieve different textures depending upon the concentration and the type of oil as well as the gelling agent that they had used. Some gels ended up with a texture which was similar to that of a thick beverage like a protein shake, while others turned out to be more like either yogurts or puddings. The researchers found that oleogels were able to deliver doses that were equal to or rather higher than the amounts that can be absorbed from tablets. The researchers also showed that a water-soluble drug that is an antibiotic called moxifloxacin hydrochloride could be successfully delivered by this agent. The researchers have also designed a dispenser that is similar to a squeezable yogurt package with compartments that can be used to separate the doses. So with the invention of gels to make swallowing tablets easier, it could be even easier to deliver the right dosage for each child depending upon their weight. Consequences of both sweetened and unsweetened coffee consumption. Several studies have observed the health effects of coffee, and they've also found that coffee consumption is associated with a lower risk of death, but did not distinguish between unsweetened coffee and coffee that was consumed with sugar or either artificial sweeteners. A cohort study published in the Annals of Internal Medicine has found that compared to non-coffee drinkers, the adults who drank moderate amounts, say about 1.5 to 3.5 cups per day, of unsweetened coffee or coffee that was sweetened with sugar were less likely to die during a 7-year follow-up period. More than 171,000 participants without a known heart disease or cancer were asked several dietary and health behavior questions to determine the coffee consumption habits. The authors found that during the 7-year window period of follow-up, the participants who drank any amount of unsweetened coffee were 16 to 21% less likely to die than participants who did not drink coffee. They also found that participants who drank up to 1.5 to 3.5 daily cups of coffee that was sweetened with sugar were 29 to 31% less likely to die than those who did not drink coffee at all. Coffee has qualities that could make health benefits even possible. The authors caution that the average amount of daily sugar per cup of coffee recorded in this particular analysis is much lower than specialty drinks at popular coffee chain restaurants, and many coffee consumers may drink it in place of other beverages that make comparisons to non-drinkers more difficult. Hence, for coffee lovers, this is definitely a remarkable find. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.